My name is Diana Flores, and my topic is growth hormones and antibiotic use in food production. Some background information that I wanted to start off with includes basic definitions to describe what these substances are. So, firstly, according to an article by Dr. Gandhi and Dr. Snetker, growth hormones are defined as natural chemicals that we produce in our bodies, but there are also some that can be manufactured to promote growth in animals. So there are natural hormones and synthetic hormones, and I will be going in a little bit more depth about those in the next couple of slides. We also have antibiotics, which many of us have heard of. It's medicine that's used to inhibit the growth of bacteria and infections. And if you've ever gotten extremely sick, you probably have to take some of these antibiotics. In Gould's article, Antibiotics from Prehistory to the Present Day, she describes how some of these antibiotics that we use are naturally produced in our environment by fungi and molds, such as penicillin. This antibiotic was first discovered in 1928 by Alexander Fleming, and it wasn't until a couple decades later when they were able to mass produce this drug and use it properly as medication for many infections during the days of World War II. So it was very beneficial during this time, but even 2 decades later, they saw antibiotic resistance as an emerging problem. And I will talk about this a little bit later as well. These antibiotics were eventually introduced for livestock whenever the animals would get sick, because it was also possible for them to acquire infections and diseases. They too had to get treated, otherwise the diseases were easily spreadable and this would affect the farmers greatly in their production. It was discovered that the antibiotics made the animals grow a little bit faster and convert their meals into muscles quicker. So this initial practice was very popular when this new information was discovered. For the history of growth hormones, specifically the ones used in food production, their usage began in the 1930s when they discovered that a hormone extracted from the pituitary glands of the cows could help produce more milk if it was injected back into another cow. This hormone is called bovine growth hormone, and if it's injected into a cow, it increases the cow's production of milk by raising the levels of another hormone called insulin-like growth factor, or IGF. Like penicillin, it took a while for people to learn how to produce it synthetically, but once they did in the 1980s, the Food and Drug Administration, or the FDA, approved it in 1993 as stated in Dr. Gandhi's article. They called this RBGH, or recombinant bovine growth hormone, to explain that it's synthetic, or man-made. In the 1950s, they could also synthetically produce a different kind of estrogen called diethylstilbestrol, and this was used to strictly increase the size of the animals like chickens and cows. It was also known as DES. It wasn't until the 1970s, however, when they realized that it caused cancer, so they stopped its use in livestock, but actually continued to use it medically for another 20-ish years, even though it did lead to different cancers. It was strictly used for the treatment for advanced prostate and breast cancer. Eventually, in 1997, they got rid of its use entirely, and there are various reports on the DES Action USA's website regarding the dramatic impacts this drug left upon women and men at the time. Some specific names of growth hormones used today in food production are as follows. There's estrogen, progesterone, testosterone, and these three are naturally made, meaning humans make them as well as animals within their bodies. Estrogen and progesterone are the female sex hormones, and testosterone is the male sex hormone. Zeranol, trenbolone acetate, and melangestrol acetate are synthetically manufactured. These are all steroid hormones, and these are the ones that are used to promote muscle growth in cattle and sheep, but not chickens or pigs. The ones that are synthetically made are regulated by the FDA, and before they were approved, they made sure of the safe levels of the hormones in the meat that we eat. Again, the protein hormone that we use in food production is RBGH, and it could also be known as RBST or bovine somatotropin. This protein hormone is only used in dairy cattle for raising milk production. For the antibiotics, some of the ones I listed are listed in the summary report on antimicrobials sold or distributed for use in food-producing animals from 2015. Some of these are used to treat these animals in case of disease or infection. Examples include penicillin, chlorotetracycline, oxytetracycline, talicin, bacitracin, streptomycin, erythromycin, and others. Some other antibiotics that are synthetically made are also used in livestock and poultry. Their specific use to increase sizes of animals was actually banned by the Food and Drug Administration back in January 2017, which is actually pretty recent. According to this same FDA article, there was a 35% increase in usage of penicillins for animal agriculture from the year 2009 to the year 2015. This resulted in a 77% increase in sales in the meat industry. So how are these substances administered? Hormones and antibiotics are both administered in similar ways. Hormones can be given via pellets, which are implanted underneath the skin of the cow's ear with a gun. They can also be mixed into their feed or into their drinking water. Antibiotics can also be given with injections or mixing into their water or in their feed. Antibiotics are given to stop disease and infection, but many times farmers would rather take preventative measures and administer these antibiotics to prevent infections and reduce the chances of the livestock getting sick at all. So that's an injection. And then this is a picture of what the pellet gun looks like, and it's being implanted in the cow's ear. So besides these substances actually affecting the growth and the size of the animal, administration of these hormones and antibiotics can affect the animal in other ways. According to a study done in South Dakota University, the route of transmission of these hormones and antibiotics can affect the animal and put stress on it as well. If the pellet is wrongly placed, it can lead to infections in the ear and swelling of the ear of the cow. Or if the animal is not staying still for an injection, for example, additional stress is added on the animal when it's being restrained. If an animal is not taking a pill, more forceful methods may need to be taken, like using a long tube to plunge the pill down the cow's throat. Also, with the recombinant bovine growth hormone having an impact on milk production, the cow will be producing more milk. The higher production of milk calls for more milking, and frequent milking can lead to infections and swelling of the udder or mammary gland called mastitis. This can actually be very painful for the cows and in order to treat this, more antibiotics need to be administered. So this in itself can be a very vicious cycle. That's the picture of mastitis. And then those are just what the implants look like in the ear. Lastly, according to an article on the RSPCA website, these implants can interact with the animal's natural hormones and it can affect the animal's behavior. Right after the implant is placed, the animal can display more aggression, discomfort, or nervousness. So when handling these animals, the farmers could have more trouble and it could get a little bit trickier. But the biggest concern about all of this is if these measures are affecting humans and human health. And if they are, then how exactly are they affecting us? There is a lot of debate regarding the usage of these growth promotants in antibiotics, especially if we are consuming these substances indirectly as well. For hormones, some overall benefits are for the farmers and those who are in charge of the production of the meat. These hormones help the animals gain weight quickly with less animal food. This is more efficient for them, meaning the farmers, as it's cost effective. On the other hand, a problem that many consumers are concerned with is the increase in this RBGH hormone, promoting the increase of another protein hormone, IGF, like I mentioned before. According to Dr. Gandhi and Dr. Snedeker, scientists at the FDA have considered the evidence from studies of cancer risk in people who have naturally high body levels of IGF-1, this insulin growth factor. High levels of this hormone in the blood have been found in women with breast cancer. There is a lot of debate whether high levels of this insulin growth factor are causing the cancer or if this hormone is just present at higher levels in a person with breast cancer. This hormone in itself is a hormone that promotes growth, so it's very difficult to measure its effects on the human body. Some studies that debunk this argument, like the ones in the article entitled "The Ultimate Truth About Hormones and Antibiotics in Food," state that because this insulin growth factor protein hormone is water soluble, even if we were ingesting these hormones along with the RBGH, they would be dissolved by our stomach's acidity and it wouldn't have any effect on our bodies. Another claim is that this recombinant bovine growth hormone is a hormone that is simply not compatible with the human's body's receptors. It is only recognized by the cow's receptors, and therefore it does not have an effect on us either. Due to this reason, the FDA still allows the usage of this growth hormone in dairy cattle. Another concern about steroid hormones like the zeranol and trenbolone acetate is that because these specific hormones are not water soluble, in fact fat soluble, then their residues in meat after packaging may have caused early puberty in girls, which is then correlated to risk of breast cancer. There is still a lot of research lacking in order to prove and verify this claim, and this is stated in several articles. The debate regarding antibiotics is a little bit different. According to an article by Shadapete, he talks about this controversy and he states some of the benefits of using antibiotics in animal feed are that they do increase efficiency and growth rate, even though the antibiotics are not being exactly used for this reason only. Animals supplemented with antibiotics in their food have displayed a growth rate of 10% more than those who are not fed antibiotics. Because the antibiotics are being given as preventative measures to keep the animals healthy and infection-free, these animals are also giving better quality meats. For example, cow's meat that have been treated with antibiotics has more protein rather than fat, and chickens have higher and better production in eggs as well. Having the animals healthy is also very cost effective, and if they can have greater meat production by not giving the animals as much food, this means low cost for the farmers, which means low cost for the consumers who are buying as well. The risk and consequences regarding antibiotic use may be a larger problem in today's world. One view in this same article is that animals being fed antibiotics will promote antibiotic resistant bacteria. Like we've learned in class before, antibiotics wipe out not only the bad bacteria, but good ones as well. Not only this, but the bacteria that does not necessarily get killed by the antibiotic can then proliferate, and there will be other strains of bacteria which won't be affected by additional antibiotics, hence the resistance. The spread of this antibiotic-resistant bacteria can be very easy. It can remain on the food after it's been packaged, as well as be transmitted through contact when farmers may handle such products, or it can remain in the wastes of the animals, and contamination can occur when it's cleaned up or gone into the runoff. In the same article, Chattopadhyay explains how those who propose the use of antibiotics are not exactly convinced that this contributes to the emerging problem of antibiotic resistance because the doses of the drugs given to the animals are very, very small, and these low doses will not select for resistance. Others, however, do believe that even in small doses, this can contribute to the resistance. It's also strongly believed that if the animals are not treated with antibiotics, foodborne diseases can be easier contracted by the consumers. This is because the antibiotics are what's keeping the animals healthy. It's very much challenging to pinpoint if the antibiotics from the agricultural animals are directly a problem because antibiotics are also widely overprescribed in the health field, and this may be a greater contributing problem than the use of the antibiotics in agriculture in farms. The economical factors regarding this issue I have already mentioned. Farmers want what is most efficient for their farms. If they are getting more meat and milk production without inputting as much food for their animals, they are making a greater profit. Their saving of money makes the prices lower for us as well, so the consumer is also benefiting. Some environmental factors regarding this issue are the fact that antibiotics and even hormones are being excreted and ending up as waste and potentially in various parts of our environment. According to the American Public Health Association in an article by Binkowski, residues of these hormone growth promoters may linger in the manure and runoff. Some of this material after rain may end up in other soils, rivers, and streams, and it can actually have an impact on aquatic life. There have been studies where fish are being affected by growing a bigger size due to the hormones, or even having a change in sex, where a male fish converts into a female fish due to the high levels of the estrogen hormone. Although some countries like the US do use hormones and antibiotics in their foods, countries like Australia, Canada, New Zealand, the European Union, and Japan do not allow the use of drugs. However, according to the American Public Health Association, this may not necessarily be due to the harmful effects the drugs may have on humans, but more so the harmful effects that the hormones have on animals. The United States Food and Drug Administration has been setting guidelines in order to address this emerging issue. According to an article by Landertz, the FDA requires manufacturers of new antibiotics to perform risk assessments to demonstrate that new drugs are safe and effective for use in animals and that there is reasonable certainty of no harm to human health from the proposed use of the drug in food-producing animals. The FDA has also developed guidance to determine the risk of antibiotic residues remaining on food products. Apart from the FDA, many other governments and professional societies have reviewed existing scientific evidence and developed recommendations to limit all types of antibiotics use, including use in food animals. Lastly, the FDA has given responsibility to veterinarians to work with farmers in order to better administer antibiotics and actually continue their use. Recommendations when going to the supermarket and buying such products are to read the labels and know what you are buying and consuming. Those food products labeled as organic guarantee hormone-free products as well as antibiotic-free products. It's important to remember that dairy and meat intake should also be limited or balanced, and if these are not composing one's diet entirely, then the risk that these products may or may not have may not be as grand. It's also recommended to have a very diverse diet and use probiotics to encourage microbial diversity. In conclusion, growth hormones and antibiotics are used in food production here in the United States in animals such as cows, chickens, and pigs. Dairy cattle specifically are treated with recombinant bovine growth hormone, a hormone that has been banned in other countries. Ever since the 1900s, when this practice was introduced, controversy and suspicion raised. Consumers were and are still concerned today regarding the possible health effects that come with this practice, including risk of cancer, early puberty, and antibiotic resistance. Effects on animals are known, including increase in weight and size, as well as more infections like mastitis, ear infections if the hormones are not inserted correctly, as well as interactions with natural hormones of the animals that may cause aggression. Such infections must then be treated with antibiotics, causing a cycle of usage of hormones and more medicine. Some factors to keep in mind regarding this issue are economical factors because manufacturers are making a better profit by using such substances, and therefore the consumers are also getting a better deal for their food. Environmental factors include the potential contamination that these hormones and antibiotics are leaving behind in the soil, manure, and even rivers after runoff. The FDA and the CDC are aware of such controversies, and the FDA has set many guidelines and risk assessments in place to continue to monitor the substance's use. The CDC agrees with the measures the FDA is doing to safely continue the use of antibiotics and avoid foodborne diseases. Some discussion questions I wanted to include are: what do you think about the usage of antibiotics and growth hormones in food production? Based on what you know and the information I presented, do you think these have the potential to put human health at risk? Are potential health risk on humans, health risk on animals, and environmental impacts outweighing the benefits? Does this information change your view on what you are buying at grocery stores? Have you been buying organic foods or will you now due to this new information?